Oh, this is gonna be good. This patient definitely smokes. You did a pretty good job. Give him credit. Oh my God. So that was pretty much what we call a plaque bridge. That can happen if you are not brushing the inside of your bottom teeth. It's a place in the mouth that a lot of people actually forget to brush. And this can happen if you don't do that over a long period of time. That was the plaque buildup that happened between the denture and the gums. They put it in a bag and then they put some fluid in there to help break down that tartar, and it's going into an ultrasonic cleaner. So that machine that you saw is a polishing wheel, and that is going to help smooth out the surfaces on the denture. You did a pretty good job. Give them credit. So I've done cleanings like this before, and honestly, a very satisfying part of it is when an entire piece of plaque comes out and then you just grab it with the forceps. I know that sounds weird and gross, but dental assistants, hygienists, dentists, when they are doing this, it is like this oddly satisfying thing. So that was a huge piece of calculus that's built up. And this looks like it's coming from a certain degree of neglect. When you're not brushing your teeth for a while, there's going to be plaque that originally gets on your teeth. And then over time, that plaque will harden and it becomes tartar or calculus, like what you see here. The amount that you're seeing is almost double the tooth size, which in itself is nuts.
Tartar alert. Cheesy looking tartar. Chip that thing off.
You can see how there's two different colors to the tartar. And what that is that's actually showing you the two different types of bacteria that is actually causing that tartar to build up. Oh, this is going to be good. That looks like a tooth. Watch how small the tooth is compared to all the plaque. Oh, I know it. What? Is that a suture? Oh my God, that's a fishbone. Oh, I've seen that before. One time I did a cleaning on a patient who had gum disease, and there was literal fish bone that came out of their gums because their gums had such a deep pocket. And I even asked them what they had for dinner the night before, and they said salmon. Oh, that's gross. Looks like they're trying to like section the plaque. Watch this. Oh, I know it's coming. The other thing is this looks like it's one of the molars, and back in the molars, I'm pretty sure this looks like, yeah, this looks like one of the upper molars. That's where your salivary gland is. It's the parotid gland. And so a lot of your saliva kind of hangs out in that area initially. And so when you have an area that is exposed to a lot of saliva like that and it's not being cleaned, that can cause calculus buildup like this over time. Same. It's like it went up and covered the gums. Okay. So look at how much calculus built up on this tooth. It went over the tooth and onto the gums. And you can see that red area that's showing up there. That is actually some of the inflammation that's caused by this buildup. And the plaque has actually pushed the gums inwards because of it. Insane. Now, the good news is since that's cleaned off, as long as the patient is maintaining and brushing in that area, the gums are going to be able to heal nicely. What is going on here? You can see that instrument kind of went underneath the gums. And so between your gums and your teeth, you have a little sulcus. And so there's that pocketing that's there. So it looks like that's what they were scraping off. So this looks like a combination of calculus with some staining. And this staining looks like this patient definitely smokes. Love the way it just flicks off. So you can see underneath the gums are red and bleeding again. Again, this is all because of that inflammation that this calculus has caused over time. This is one way that you can get gum recession. Before, after, look at that. They did a really good job here.
Dental calculus. Or dental tartar.
Oh my.
Yellow or brown colored deposit.
It's literally making it seem as if this person has more tooth structure than they actually do. I can't imagine what this person's breath smells like. 2 years since they got a cleaning, looks like. Yep. Look at all that gunk. Again, the multicolored staining you see there is coming from different types of bacteria in this person's mouth. There are over 700 types of bacteria in your mouth. And when they hang out for a long period of time, this can happen. Oh my God, this looks like a coral reef. This is bad. I can smell it. I can smell how bad that is. There's recession. There's inflammation. This patient's definitely going to have sensitivity after this cleaning, because what happens is when you have that much plaque buildup or that much calculus buildup, anytime something cold touches it like air or water, the patient's going to get a lot of sensitivity. This will go away over time, but they're definitely going to be sensitive after this cleaning. Look at that. That's all root structure there that's exposed. Oh my God, this before and after. Wow. That patient also definitely had bone loss because of this. And so I can imagine those teeth that are remaining, and they're definitely at high risk for losing them. If you enjoyed this type of video, I have more just like that. You're going to want to check out this one. We dive into tooth decay, and there's some gnarly stuff going on in there. I'll see you in there.